The host is keeping everybody muted. If you have questions, what you'll need to do is scroll on the bottom of your screen, and there is an option to chat, and you can type your question in a chat. All right, you can go ahead, Lisa.
Jen, show you how to put on and take off a mask and gloves. We'll start with that. So for a regular procedural mask that has the ear loops, you're just gonna hook it over your ears. Make sure that you get that, what's it called? Yeah, form it around your nose. Get as tight a fit as you can, and then make sure it's around your chin as tight as you can. I know there will be gaps. So for these types of masks, they can be reused. What you want to do when you take it off is make sure that you fold that outside together. So if you take it off without touching the outside as much as possible, you want to fold that in. It's going to be easier to do that with a homemade mask, I think, than it is with this type, but they can be reused. Okay, so before you even put on your mask, you want to make sure that you use hand sanitizer. You want to make sure you use hand sanitizer before you take off the mask as well. So you don't want to be touching the mask at all without using hand sanitizer first, whether you're putting it on or taking it off, okay? For gloves, everybody should know how to put them on. You want to make sure you use hand sanitizer first, then put your gloves on. And then when you're going to take the gloves off, you want to kind of pinch it in the middle of your palm. Yeah. Pull it off, and then tuck your fingers up underneath of the cuff. And then you want to throw those away. If you're in a home, you want to try and throw it away before you even leave the house if possible. So I don't know if you're going to be carrying a bag with you to put them in, or if they'll have a trash can available for you to throw them away in. But you want to try and throw those gloves away before you leave the home. Okay. The mask, you want to have that on before you enter the home. You want to have that mask off when you exit the home. You take the mask off after you exit the home. Okay. So to go over some high risk and medium risk, let me just give you some scenarios. So just assume that your person has COVID-19, okay? So if you go into their home, you're gonna be there for more than a few minutes and you're not wearing any protective equipment at all. If they're not wearing a mask and you're not wearing a mask, you're at high risk, okay? These people would be recommended to stay at home for 14 days, but with the new guidance out for essential personnel to continue to work, then they would be able to work as long as they are asymptomatic, but they would be required to wear a mask for 14 days during any kind of patient interaction. And if they should become sick, they would have to stay home. Let's see. So if you go into a home, somebody is positive, they are not wearing any mask themselves, but the healthcare worker is wearing a mask and gloves, you're considered low risk. Okay, so even if they're not wearing a mask, if the patient's not wearing a mask, you're considered low risk. If you are in a home where the person is positive and you can get them to wear a mask. And even if you don't wear a mask, but they do, you're considered medium risk. Medium risk should also technically stay at home for 14 days to monitor for symptom onset. But like I said, with the new guidelines for essential personnel, you can continue to work as long as you're asymptomatic, as long as you wear a mask with every person. So if you go into the home where somebody is positive and they do wear a mask and you also wear a mask, that is considered low risk. So if there's any chance that you can get your patients to come to the door or out on a porch, that's going to be your best case scenario, okay? Especially if you don't have to spend a lot of time with them. If they can come to you to the outside, that's better than having to go into the home. If you must go into the home, if you can get them to wear a mask, that's great. You should also wear a mask. The gloves are not as important unless you know for sure that you're going to come into contact with secretions or they are actively coughing or something like that. The gloves, even if you wear a mask but no gloves, you're still at that low to medium risk, okay, depending on their status, whether they're sick or not. If you do have to go into the home, you want to try and make sure any other household members are in different rooms if possible, and only be with the person that you're there to see. And then try and keep a 6-foot distance from them for the duration of the visit if possible. Let's see. So for the cloth masks, I have mine here actually. Let's back up a little bit. They're kind of similar to the other masks, but this one hooks over my nose. These are going to be easier to reuse because they can be washed. You can hand wash them. You can, depending on how they're made, you can hand wash them or machine wash them. I would recommend air drying if possible. So if you're able to get a hold of a couple to switch out, that would be great. If you are going to be reusing masks, it's best if you have a container to put them in between uses, and something that can be sanitized as well. So like a plastic container with a lid that can be wiped out with Lysol wipes or Clorox wipes or whatever you have to clean it with. If you're in the home and they are actively coughing, they are not wearing a mask, you might want to consider, if you're using a disposable mask, to go ahead and throw that one away, because you can probably assume if they're coughing and they're close to you, it's contaminated. So you would want to go ahead and throw that away. There was something else I was going to say and I can't remember what it was. Do you have any questions right now?
What if you are, for instance, what a lot of our home visitors might be doing is monitoring medications. So they may be handing someone medications that they've picked up from the pharmacy. In terms of transferring of objects, if you had to have them, let's say, sign something, can you give us any information about that, please?
Yeah, if they have a pen of their own to use, I would just recommend they use their own pen. As far as the paper, if you have a clipboard or something that you can take with you that can be wiped off instead of putting it on a countertop or something, that would probably be better. Something that can be sanitized will be less transfer on paper and stuff like that. If you have to take a pen in with you, make sure that either you have extras that you can either leave it there at the home, or you can clean it with whatever wipes or sanitizer you're using. I think you did mention that some people might have to transport someone.
Yes.
In that situation, the best thing that you could do is to, so you have your person as the driver, have the passenger sit in the back seat on the passenger side so that they're the furthest away from the driver. And if you can get that person to wear a mask while you are in the vehicle, that would be the best thing to do. If not, I would, as the provider, I would go ahead and wear your mask, and then just wipe down seats, doorknobs, window buttons, whatever might have been touched after each use. Any other?
We had a few join us late, so I was just letting them know they can ask any questions they may have in the chat. So it sounds like hand sanitizer is going to be the most important.
Hand sanitizer is exactly right. Most important thing in and out of the home before and after putting on your mask and gloves. So you're going to go through a lot of hand sanitizer. And if that's the only thing that you have to clean your pins with too, you can use that for your pins.
How often would you recommend washing the cloth masks? I mean, if you have,
I would say at least daily. Yeah. Yes. If you're actively using them, I would definitely be using them daily. And if you, like I said, if you are seeing multiple people in one day, it might be a good idea to have multiple available just in case. Yeah.
And so to your point earlier, it sounds like if they have an option to carry extra disposable masks with them to offer to the individual they're seeing.
Yes. Yes. And there's a lot of people making those cloth masks too. So if you can get a hold of some of those, you can direct them how to use those as well.
We do have a question about how often should you dispose of filters for a cloth mask? I'm not familiar with what filters are.
Like I said, the cloth masks are being made differently, so I don't know. It depends on what they're made with, and I don't even know, some of them may not be washable, so I do not know.
Okay. Rich is holding up it looks like some type of paper cup that must go inside.
I'm not familiar with that kind of mask, so I would go by whatever if it was something that was ordered, I would go by whatever the manufacturer says
Recommendations,
to do. And then if it's something that's handmade, depending on what it is, I mean, if it's something that's going to deteriorate, you obviously don't want to machine wash it. You might want to just hand wash.
When you say hand wash, what type of, I mean, should it be an antibacterial soap? Is laundry detergent sufficient?
You can use laundry detergent, dish soap, anything like that. Yeah.
Hot water, cold water, does it matter?
I don't think it really matters. Just the friction and do it for a while, a few minutes.
All right.
Kind of like hand washing. The longer you do it, the better you are.
The ABC song or a couple other songs I've heard, yes. Yeah. All right, anybody who joined us late, if you have any questions, you can ask them in the chat. If you missed some of the demonstration at the beginning, we will be posting this video on our YouTube channel. I am not seeing any other questions, Lisa. So you and Jen must have done an excellent job.
I don't know about that, but if anybody has questions, just email them to me and I'll get back with you.
All right.
Okay.
All right. Thank you very much. Everybody stay safe and healthy. I appreciate your time this morning, Lisa and Jen. Thank you very much for doing this.
Thank you.
Take care. Happy Easter, everyone.
Thank you.